Director of Community Relations here at Aoma. Aoma's mission is transforming lives and communities through graduate education in Oriental medicine. And part of our vision is bridging gaps between allopathic and integrative medicine. So the East-West Forum, the panel that you're here to see this evening, is one of the ways that we bridge that by having practitioners from more Western backgrounds and practitioners from more Eastern, alternative, integrative backgrounds speak about a topic. This evening's topic is Integrative Sports Medicine, and we have a wonderful panel of speakers. I'm really excited to hear our discussion this evening, and I'm going to just give a brief introduction to the three of them, and then I'm going to let them do some opening statements, and then we'll just get into questions. I did want to point out that, so your cell phone, I set up this fancy website thing that will actually allow you to text in your questions, and it'll show up here. So I will also take questions from the audience, so if you really want to interject something or whatever, we can definitely have a conversation back and forth, but this will kind of allow me to kind of know what people are thinking, what people want the direction of the evening to go in. So feel free to text that number and your message to that phone number. That'll be fine. All right, I'm going to go ahead and introduce Dr. Martha Pyron. She's a board certified in both family medicine as well as sports medicine, and she's the founder of Medicine in Motion, a sports medicine and physical rehabilitation clinic in North Austin that has integrative care approach to injury and illness. And I'll just go down the row and then we'll do our opening statements. And then to her right, Dr. John Tuggle, Doctor of Chiropractic, is also known as the Tri-Doc, and he has an integrative practice in Cedar Park. And then immediately to my left, Ann Mowat is a licensed acupuncturist and certified sports medicine acupuncturist specialist. She's the founder of 512 Wellness in Central Austin, and Ann is also a graduate of Aoma's master's degree program. So why don't we start with you?
Okay.
All right. Thanks, Sarah.
As Sarah said, my name is Ann Mowat. I'm a licensed acupuncturist. I graduated from Aoma in 2007. Prior to that, I had worked in advertising at various advertising agencies for about 14 years. It took me all over the country, and I ended up in the Bay Area. And while in the Bay Area, I fell in love with acupuncture and natural and alternative healing methods. So I decided to move back to Austin and started attending Aoma and graduated, like I said, in 2007 with my master's degree. I opened up my own practice soon after I graduated and started to treat a lot of pain clients and realized that there was a lot more to pain than I had originally anticipated. So I sought out different ways of treatment, and I found Matt Callison. He's an acupuncturist in the San Diego area, and he has a program called the Sports Medicine Acupuncture Certification Program. And it's a year-long fellowship in acupuncture and Chinese medicine. I flew out to San Diego once a month for a year, had some exams and practicals. It was a pretty rigorous program, heavily based in Western anatomy and orthopedic procedures, which was really, really wonderful to learn. And then because it's an acupuncture program, it also had a strong foundation in acupuncture. And so what I found is the marriage of the Western orthopedic model overlaid on the Eastern traditional Chinese medicine model is a really wonderful way to treat pain. Learning muscles and motor points and functional anatomy and how they work and how people move and how bodies compensate for pain patterns throughout the course of an activity, whether they're a weekend warrior or they're somebody dealing with chronic pain or they're a professional athlete. So that program really taught me how to assess pain and treat it in a very different way. So I've been pretty much focusing on that. I also have a strong interest in just kind of keep learning. I've been taking courses in neurokinetic therapy, which does a lot with like brain proprioception and making sure that understanding like how the muscles in the brain communicate. A lot of times the muscles just kind of become a little bit tired and get compensated for. I'm also doing some course training in color puncture to treat in a non-invasive way at a deeper level. And I've also done some kinesiotaping work. So in addition to all that, I do sponsor the Austin Women's Cycling, Austin Flyers Women's Cycling Team, Bicycle Sports Shop Club teams, and I think I'm the unofficial acupuncturist of the Austin Rowing Club. So yeah, so that's my story, and I'm really excited to be here and to share about acupuncture and sports medicine. Thank you.
I hope y'all don't expect that much out of me. My name is John Tuggle. I'm a chiropractor in the Cedar Park area. I've been practicing since 1999. I graduated, and I've been in the Austin area this whole time. And around 2006, 2007, I started training and doing a lot more athletic type stuff myself, and I really got into that. And so I was like, hey, I want to start treating these people. So I kind of focused all my continuing ed and all my training from there, like active release and Grasson therapy and just different things like that that really benefit patients, I have found. I've done all my continuing ed to kind of dedicate my practice towards fixing athletes, and so that's what's happened really. So I've had a real hard push with that, and I tell people I have my dream practice today because that's pretty much what I treat. So.
Martha Pyron, like she announced, board certified in both family medicine and sports medicine. And what that means is I did a fellowship in sports medicine after my family practice residency. And like John, I have been involved in sports myself, and dream job would be to treat athletes all day, which is super fun. And right out of training in 1999, I didn't realize we graduated at the same time, but anyway, right out of training in 99, I went to Penn State. I was one of their team physicians, and then I moved to University of Texas, and I was one of their team physicians. And then I got a little bit tired of working with just the college-age sort of population, and I left UT and started my own practice, and that's Medicine in Motion. And I feel like my version of an integrated approach is realizing what I do is great, but is not always what the patient needs. Sometimes they need other things as well. Sometimes they need a chiropractor, and I work with John, and we send patients back and forth. And sometimes they need an acupuncturist, and I've had an acupuncturist work in my office, and I don't currently, but I certainly refer to acupuncturists as well. And I really feel like rarely is there one absolute thing that patient needs, and there's no other alternative. Most of the time, there's a variety of different ways that things can be approached, and by working together as a sort of team approach is really most optimal. And I agree with what you were saying about orthopedics and acupuncture. The most success I've seen is in that combination, really, is acupuncture and physical therapy, working together. And I've really enjoyed being able to do that in my practice. So I do have physical therapy in my office. I have 4 practitioners right now who do physical therapy. I also, when I do just the MD part, I sometimes take X-rays if I need to, or I do procedures like injections if the patient needs that. But my most enjoyable part of my practice is really trying to pinpoint what that person's, what brought them in, and really what is the cause of that problem, as opposed to just treating their symptoms. And so I think my patients appreciate that, and it makes my job really rewarding when I do a good job with that. So that's all I have to say.
Right, thank you so much. So I want to ask one question, and then we'll kind of, if one person wants to grab it, you can, or we could go down the row. We'll see how it goes. So I'm curious, from each of your discipline, what recommendations you have for preventing injuries, and if that's something that you do speak with your patients about. So anyone want to take the first stab?
I'll do it.
Sure.
So I feel like I have the luxury sometimes of doing physicals on people. So before a sports team has their season begin, their kids, they have to get a physical, and they sometimes come in to me for that reason. And to them, it's just a form they need to have filled out. But to me, it's an opportunity to look for, of course, medical things that might cause them to have serious problems, and that's rare, so that's not a big part of what happens during the physical. But in the musculoskeletal realm, it's looking for imbalances where they may have tightness or flexibility issues or weaknesses in one part that's not counterbalanced in another area, that can lead to compensation in different areas, that can lead to pain. And they may not have that any pain or symptoms associated with it at that time, but it gives me an opportunity to try and evaluate that and give them some advice on how to prevent that by, you need to be more flexible with your hamstrings, or you're going to get back pain or whatever. So my approach, most of my patients are seeing me for musculoskeletal problems, usually pain, and my approach with prevention is trying to see if there's an imbalance ahead of time that we can address and then therefore prevent that from becoming a painful source.
So I'll just couple on that. So similar to that, I talk to athletes quite a bit at various events around the Austin area, and so I'm really big on just a lot of basic things. It's amazing that we're seeing a lot of athletes at all different ages now that are starting to do stuff, and they just don't really have any idea. They're just like, they just go get a couch to 5K program and they just go, and so they don't really have any concept. So I start back, I'm like, what kind of warm up do you do? And I'll talk to them about foam rolling. And then another end, what you'll see is that you'll see somebody, they go, I use this funny term in my office, I call it psychobilly. They just go wide open into one particular activity. So whether that's running or cycling, and they're doing that all the time, but they're not, they start to have imbalances because they have weaknesses, because they're just doing everything in one plane. They're not really changing it up. So I'm really big about talking to people. One of the main things that you'll see all the time, and I know Dr. Pyron sees this all the time too, is core weakness. You have core weakness problems, and so I'll talk to people about cross training, that lifting some weights from time to time is going to be real beneficial to help work on these weaknesses before they get exposed into a problem. And then sometimes I don't see a whole lot of it, but just pure weightlifters. I'm like, look, you probably need to do some cardiovascular as well. So just cross training in general is a really, really healthy thing that they can do to be able to help prevent stuff.
Yeah, I think acupuncture is a little bit different in that regard, because a lot of times, for an acupuncturist in the room, it's like we tend to get clients when they already have stuff going on. So it's a rare opportunity to kind of get somebody kind of at the beginning of their journey. So I think my approach is a little bit twofold, or what I see is I'll have somebody coming in with like a primary injury that we're working on, and then of course, because we have such a long intake that we do with clients, you tend to start seeing where there's some potential issues that could pop up down the line, and I tend to gravitate more towards helping them kind of off the field, so to speak, working on strengthening their digestion, going through their nutrition. Are you hydrating properly? Are you resting? Are you listening? Because kind of the weekend warrior type, or the people who go all out, they're really pushing themselves and they're not allowing their muscles a chance to recover. And so it's more about like lifestyle adaptations and how to kind of get a little bit more balance altogether is really, I think, where prevention might come into way in my practice.
Let's talk a little bit more about the recovering from injuries. Just who wants to hit that one first?
Here we go. So I think again, the problem becomes by too is it's going to be is where the patient is at as far as their coachable level. You see all different, you see everything. You see people that don't want to hear it, and some people are just like, fix me. But I think the biggest thing is I'll tell people, I'll give them some short-term advice, because once that injury's developed, I mean, you got, in my opinion, you got about 10 or 14 days. If the pain is still hanging around, there's going to be something that's probably not going to go away on its own. So if foam rolling or stretching or resting is not really taking it, it's time to seek help, healthcare provider for that particular problem. And so one of the things I'm really big about it, going back to the prevention stage, I always tell people, like, look, you need somebody in your corner already. So a lot of times, not waiting until you have an injury showing up, but having somebody like Dr. Pyron or having acupuncture or whatever already in your, that you already have a relationship with. That way, if something creeps up and you're ready, you kind of jump in there. And that really treating something from an acute basis to get in there. I mean, an acute injury for me is usually, for most part, is relatively easy, as opposed to when they come in and say, yeah, I've been dealing with this for 3.5 years. It's like, oh gosh. So we have to start back, because then you have all kinds of secondary problems because they've been stuck in that pattern for so long. So it becomes a big issue. So really just quickness, coming in, and then you have to realize that you have a pushback with a lot of people in the athletic community because they want to fix everything on their own, but they're going to suffer for that if they do.
So recovery, yeah. So most people that are in enough pain, they will take the advice of you need to give yourself a little bit of rest, some recovery time. But some people don't. The same people that you see that will just push themselves. So sometimes it's a discussion about that. You need to have recovery time and not push yourself through that. So that's a conversation I end up having quite a bit. And then I have a nutritionist as well in my office. It's looking at the more global picture as well. Are you eating properly? And back to my first comment, like, what caused this in the first place? You know, was it too much training in a short period of time, like you were talking about? Or is there some other issue going on? Do you have a thyroid problem that's causing your tendons to have an issue that made you have this tendonitis type of a deal? You know, what else is really contributing to this? Or is it really a simple injury that there's nothing more to it? So it's looking at the bigger picture, trying to find what the source is, and then talking them through the different changes and ways they can balance their life, either by nutrition or rest or activity or different sports, same thing we've been talking about.
Yeah, definitely agree with both. And I also, what Dr. Togo was saying about educating clients to have you be part of their team is a really big, important part in their healthcare, and also in terms of like just helping them get better and getting better results, because then they're coming to you before things get to a really crucial stage. In terms of recovery, acupuncture treatments, of course, and a big fan of kinesiotaping. I find that that's really very helpful. Herbs are also really helpful, topical elements. So that's, I think, we have a lot of little tricks up our sleeves as acupuncturists that we could, there's a lot of things that clients could do at home as part of their self-care in terms of recovering. And I've also seen that when you give people homework like that, it makes them feel like they're doing something for their pain, which helps them get out of their cycle of, oh my gosh, my leg still hurts, I'm never going to be able to run again, which is also managing that psychological stress of athletes is also a big part of managing their pain profiles. Great. We have our first question. But before we get to that, I want to find out who is in the room. How many people here are practitioners or studying to be practitioners in the medical field? Would you raise your hands just so we can kind of have an idea of who we're talking to? Okay, and how many, thank you, how many people are here more from like, I'm an athlete, or I'm here as, you know, for myself? Some of those might be the same people. Go ahead and raise your hand. Okay, so we have a lot of practitioners. Any other categories that I might be missing?
Personal trainer.
Personal trainer, okay, that's a practitioner. Great. So someone texted in, many injuries are due to tight muscles. How do you help the hypermobile athlete? And I actually want to know the answer to this because I'm one of those. Does anybody have tricks for hypermobility?
Okay, that's a difficult area.
Yeah.
So my first thought is, again, as an MD, is there are some medical conditions that can cause hypermobility that can also be associated with heart problems and other more serious difficulties other than muscles and tendons. So I would, again, evaluate them pretty thoroughly and try and make sure there's not something more going on, genetic or whatever. But, you know, if you're otherwise fine but mobile, it's really a matter, in my opinion, a matter of strength and technique. So if you are hypermobile, your joints want to move that far or are able to do that, and you can control it with your strength and technique, then you'll help prevent yourself from having injuries associated with that. So that's sort of the way that I take that approach.
Yeah, so really close on that, I always look for something else that there's going to be, that you're going to have there's some reason that there's an overcompensation there. So a lot of times there's still going to be something else that's structurally bound up. So I would look for, if you have some area that's making up, that is become hypermobile because something else is a limiting factor. So for my take to that, where I would go to it, it would be either a limiting factor or a weakness somewhere else is where it's going to go.
I don't feel like you all have to answer all of the questions, but if we have something for this one.
Yeah, actually I do. I work a lot treating with pain. Part of the Met-Cal and the sports medicine program was dealing with muscle motor points. And motor points, slightly different than trigger points, it's kind of like the area of the muscle that kind of communicates to the brain and spine. And what happens when a muscle is injured is it's either contracted or stretched. And so by needling into the muscle, it's almost like the reset button on the computer. So it helps to reset the postural imbalances that are occurring, and also kind of working in an agonist-antagonist relationship. So a great example of that is quad and hamstring. So looking down the line, looking at the front spiral line, or the frontal line and the posterior line, creating a balance, trying to anticipate where muscles are being compensated, and doing so by really knowing anatomy and kneeling in the motor point to just kind of reset those muscles, and it actually is really helpful for clients.
Did the person who texted us in have anything else to add or any other additions to the question? Thank you very much for participating in my interactive. So I'm curious to know what trends you guys are seeing in your practice. Are there more of certain things showing up these days? Or I guess another way to think about the trends, are there new ways that you're treating things that you've been seeing for a long time? It seems like we're just starting with you and coming down this way.
So I live in the insurance world, and the biggest issue right now and the biggest trends are really all the things that are happening with insurance. So, I mean, that's a daily struggle with my patients right now, is trying to figure out what their benefits are and how to get them taken care of. And I know that some insurance plans will cover acupuncture and also chiropractic care, but I mean, every patient, it's a conversation for me. So that is the biggest trend, is all the politics associated with that. But maybe remove that and talk about sort of philosophy in my world has changed a bit with regard to chronic tendon injuries or chronic pain, and the approach to inflammation. So in the past, like when I was in med school, which was not that long ago, but you're injured, it's swollen, you take an anti-inflammatory and you rest it, and then you brace it if you need to, and then elevate it and do all the things you can to decrease inflammation, and then try and work back into activity as it's healing. And those are still relatively good concepts, but inflammation is also the first part of the healing process, and some people that injury needs that to move on to the next phase, and to the next phase to actually heal. And so what I'm seeing trend-wise in probably the last 5-10 years is really more of how chronic tendinosis type injuries have changed from trying to either put an anti-inflammatory or steroid on it to calm it down, really more to try and increase the circulation, increase the inflammation again, in hopes that the healing process sort of returns and you finally have healing in the area. So I think that's the biggest change in the last few years, I think.
So that's kind of two questions you gave us. So I guess the first part I would see, as far as from an athlete base, because my clinic is primarily athlete focused, I'm seeing a huge difference in what I have seen as far as in the past. And even if I go back and just doing some of the research on the 70s and 80s, there was a limited portion. We'll say runners, for example. It was pretty much elite runners. But today you're seeing such a broad spectrum of athletes. You're having people that are 30s, 40s, and 50s that are starting a 5K and ran for the first time. So I have people in my clinic that are like an 18-minute mile pace, and some people are a sub-5 pace. I mean, they're all the way in. So it's really exciting to me, and you're seeing all different kinds of stuff. So the people, from athlete standpoint, the patient base is growing very quickly. So I'm seeing that. On another note, from a provider standpoint, what do we see in differences is one of the things that I really see is that I personally worked with Dr. Pyron before, so we've had a relationship that we do a lot of referrals back and forth. So we have a personal relationship, a business relationship that we've done with for a long time. But what I'm seeing, I think that you'll see that, like even when I started practice, I started in when I got out of school in '99. I mean, as I was going through school, everything was MDs are bad, and everything I was hearing were the MDs are bad and they hate us, and so we got to hate them back, and that's what it was. And I think we've seen a huge shift, and I really think that sports medicine is where a lot of this shift is occurring, because you're seeing now it's not about whether Dr. Pyron is better or whatever. It's like what's best for the patient. So what you're seeing is synergy occur across the medical spectrum that you're seeing, and I'm telling you, of all things that I see, is the patient wins of this. So if I have a patient and I can perform part of it, I'm like, I can do this, and I think I can help, but I think they really need a medical doctor in this, and I just say, hey, we're going to co-treat this, and we do that, and really the best thing for that is that patient really wins out of this, and that's what we're all in this game for, is that we started this to do what's right for the patient. And so when we co-treat and we do whatever it takes, and whether that's me fixing them, so if somebody comes to me and I can't do it, but I send them to Pyron and she fixes them, then I've done my job. even though I never did anything, because my job is to get them to the place that can get there. So you're seeing that is really growing, and I think in the sports arena, we're pushing it, and I really want to see that domino through the whole medical community. You're going to see that come across, and in sports medicine, I feel is leading that. So to me, that's like really exciting, and the patient really wins in that.
I just want to add on to that, because I have worked in Division I university sports medicine, and I've also worked some Olympic sports and Olympic Training Center, and I agree, it's in the sports community where that's happening. Not so much for the non-athlete, but if you go to a training room for Division I, there's a chiropractor that comes in, there's a physical therapist, there's an MD, there's a nutritionist, there's sometimes acupuncture. I'm not sure, all departments have that, but they're looking for a variety of ways to help this particular athlete get back as fast as possible because of all the, it's Division I university or whatever, but it's a team approach and recognizing that some people can bring one thing, another person can bring another, and not one thing, is the only thing. You have to be more open-minded about that, and I think I agree that there has been some animosity in the past. When I went to med school, chiropractors were stupid. Sorry. And they're not.
That might be true in my case.
Okay, not for stupid. I mean, I got sort of that same dogma in my training, and I didn't have any experience with chiropractors. It wasn't until I got out in practice, and it's true. Sometimes I see people that went to a chiropractor, and I wish I'd seen them a little bit sooner, and they had not. It was not suggested that they come see me or another physician. And so there are times when I feel like, if we just worked together sooner, that would have been way better for the patient. And the other's true too. I mean, there's physicians that will not refer to a chiropractor. It's just not going to happen. Or acupuncture, and that's just unfortunate for that patient. But I do think it's in sports that's changed for a long time, and hopefully it does trickle out. That was actually one of the main intents of my practice when I started, was to bring what the athletes get in an athletic training room, bring it to the average community person. So they do have a chiropractor that they can see, or I can send to them to, or an acupuncturist, that we work together and provide that same really high level of care.
Yeah, I totally agree, and I think that's the most exciting part of my practice is building an integrated team, and I think clients really appreciate it. I think they respect you a lot more when you say, look, okay, this is what I've done, this is what I think needs to go, and this is where I think you need to go to get it. I think it makes them feel like a VIP, and that people are really looking out for them in the bigger picture. In terms of trends, I guess there's two: CrossFit, and CrossFit. I see a lot of CrossFit athletes who are kind of moving through things a little bit too fast, and so we've got to work on injuries and a lot of compensatory patterns there. And I think in terms of chronic autoimmune issues are really kind of flaring, fibromyalgia type clients and lupus, those chronic, really troublesome, hard to treat chronic diseases that usually by the time they kind of find their way to my office, they've been dealing it for a really long time and have a lot of discouragement along the way. So I think those are the trends that I tend to see in my practice.
I love to hear about this trend, because I'm outside of this world, and I love to hear that sports medicine practitioners are the ones that are kind of, it makes sense that you're team players, right? Because you're in sports medicine. I'm also loving to see that we're getting some more activity up here on the screen. So, oh goodness, I better start asking some of these before they get out of my... So I was also going to ask about nutrition. Let me see what we have here. What nutritional advice would you give to someone trying to overcome an injury? I know you mentioned you have a nutritionist in your office, and I'm assuming that you also do some nutritional consultations too. So you want to start this one? Or,
sure. Excuse me. I think for nutrition, where I'm kind of settling is to kind of do plant strong, not necessarily vegan or vegetarian, to have protein in your meal, but make it a 2-to-1 ratio of green veggies to a protein. The veggies kind of act as a buffer to help balance the body in kind of a more alkaline, acidic state. So when you work out, you're burning muscles, which creates a byproduct of lactic acid. So by taking supplements that are the electrolytes of calcium, magnesium, sodium, and potassium. It helps act like little buffers, and they go and clean the lymph system to help in aiding recovery and inflammation. So I think In terms of nutrition recovery, that was the question, right? Yeah, that's kind of where I am kind of leaning my clients towards right now.
Mine's pretty basic. I tap out on this one pretty early. I try to be really good at what I do, and I do a lot of muscle work. I'm a manual therapist. I do lots of stuff with that, and so nutrition is not my forte. So I'll do a couple little things. I see a lot of people with electrolyte deficiency, so if it's something that really pops out and it's pretty simple, I'll attack it. But if it's not, I quickly refer for this one.
Me too. No, I'm just kidding. I do have a nutritionist, so I'll send people to her if there's a question. But for like a general approach, my general statement is back to balance. I do see patients that run into trouble who are restricting their diet. They're being very specific about supplements that they're taking instead of looking for ways that they can eat a healthy, have a healthy intake that are natural foods. And I'm not a big proponent of you shouldn't eat this meat or that meat or whatever. I mean, you need to have some protein, you need to have some carbohydrates, you need to have some fats, you need to have balance of the vitamins and nutrients and electrolytes and minerals that are in the different foods that we want to eat. So there's a small subset of patients that are really difficult to work with that restrict what they eat and will only take a supplement or only take a protein powder or something like that, and that can be very difficult to work with them to get back to having a little bit more balance to what they're doing. So I don't have a specific, you should eat this at this ratio and this amount, or whatever. I have hey, make sure you're getting a little bit of this, a little bit of that, just as a general theme, that a well-balanced diet, meaning you have a variety of things, you're not always eating the same thing or always taking the same supplement or whatever. And then I refer to my nutritionist beyond that. And again, it's just where I see this, where I end up having an impact is the folks that are having medical associated illnesses related to how they're eating. In sports medicine, the most common thing that I see is restrictive type of diets, where they're only eating certain things, not eating other things. The other spectrum is, people eat too much and then you lose weight, and we work with that as well in sports medicine, trying to get people fit and active again. But much more challenging is people that have a very specified diet that they follow that may not be balanced enough for them.
So did the person who texted that question in, do you have any specific questions about certain supplements or foods that you were curious about or feel complete in that answer?
Yep.
All right, thank you. So I like this next one. What's the next big thing that's going to further the field of integrative sports medicine? Does anybody have ideas of what's coming up at the cutting edge? What's the next big thing? It feels like this conversation is partly saying integration, but it sounds like you guys in this field are already doing some of that. So what's next?
I think the trend what I see maybe possibly coming next, just in some boards and groups that I belong to, is the idea of functional anatomy, the idea of assessing clients in movement, not just in a static way like, oh, my knee hurts and okay, this is the way I treat knee pain. It's like, why is the knee hurting? Is it because the foot is not making proper connection to the ground? Is there something going on with the hip? So I think that seems to be maybe, in my opinion, the next step is to looking more at the clients more in terms of movement and how movement may or may not be affecting their pain pattern.
Yeah, so that actually I do some of that. So I do SFMA, which has to do with some of that. So that's really good, analyzing the movement. Again, I think a lot of it is just we continue to head towards more prevention. I think a really cool thing, our patients, our athletes that we're dealing with now are really educated, and they use the bad word in the office, the Google word, which has lots of good stuff on it, right? But it's got some bad stuff, and you can get hung up on one little thing, kind of what she was talking about. Sometimes they come in and they got one thing, they've been reading one page, and you're like, you have to smack them to reset them, and they like that. No, so I think that you see that we have a lot of people that are getting educated, and people are pushing out and they're looking. I think we have more of an informed consumer, an informed patient that you see that, and so that's exciting. I think they come. I mean, part of the time I'll come in and I have kind of a standard spill. These are some things we're going to do and all that kind of stuff, and I go through my spill and I'm like, do you have any questions? Like, no, I already read all that. You're like, all right, well, let's go, so you're seeing some of that. So I think that's exciting that hopefully people can work more the prevention realm, and people are they're really taking ownership. Where before, I think if you go back, it was like, just fix me, and now it just doesn't work like that, especially when it comes to a sports injury. If they're doing something wrong and got them jacked up to start with, you can't just fix them and then they go back to doing the same thing, same problem's gonna come back. So they become more, they're getting more coachable, they're more informed, they're like, look, we're gonna have to modify what you're doing so you can keep doing what you're doing. Because people wanna do it for a long time. I mean, I have people that come in, they're running, they're doing half marathons all the time, they're 55, and they're like, I don't see any end in sight, so we have to work really hard to be able to keep them to do that. If they wanna do this in their 70s and 80s, we gotta take care of them. So, and they gotta be willing to take that as well, so.
So I totally agree with what you were saying. If you just look at a swollen knee, but you don't put them through some sort of functional evaluation, maybe you can't do it the day they come in and they can't walk, but that has to be part of the treatment and the thorough evaluation. So I think that's a great trend to be heading towards, and we do that in physical therapy, of course, all the time. So again, back to that combination, working with acupuncture and chiropractor works really well. But as far as trends in sports medicine, in my world of sports medicine, I think the thing coming next, I would hope, would be the acknowledgement of the value of integration. I know that you said that, but and some athletes know that, some people don't. I still have people that come in and I say, well, I think you should see the chiropractor. I'm like, what? I'm not doing that, or acupuncture, I don't know about that, there seems to still be two pretty set camps of you see a physician or you see someone else. And I am hoping that as time goes by that we are working more and more together as a team approach, and patients recognize that, and that they're educated about that. And that they come in and may already be seeing someone else, but we can talk about that. Because I still run into trouble with, not you guys, but other chiropractors. I'll call them, hey, what are you doing over there? Let's talk about it. And I never get a call back. I never have that conversation. And that some people are less interested in having that conversation than others. And I'm hoping that as a health community that we grow in that direction, but also that the patients grow in that they recognize that there are options that might be useful to them. So, did I answer that question? Okay.
For the record, I don't do that. We text on a regular basis.
The last part that you just touched on kind of touches on this last question that just came in, is how do you ever come across situations in an integrative setting where there's a disagreement between practitioners about what's best for the patient? And I'm assuming they also want to know how you would deal with that. I don't think I've had that experience yet, thankfully. Most people that I work with are, I think as Dr. Tuggle was saying earlier, are really there to service the client. And that's really the best interest. So I have not, every other type of practitioner outside of the acupuncture field that I've had the opportunity to work with, it's been a very supportive and very professional and encouraging relationship. So I don't know, maybe you guys have something?
So I run into this from time to time. It doesn't happen a whole lot because I think there's like a sort of level of mainstream that if you stay with them, it's not going to happen a whole lot. It does happen from time to time that I'll disagree with their approach, but the first thing I always do is I want to honor and respect whoever's giving them that. I don't know where they're coming from or what exactly their thinking is, and if I haven't spoke with them, I'm not going to start talking bad about another practitioner, unless I feel that they're in harm's way at some point or fashion. If it's really crazy, like, no, you're not jumping off the roof, or something that might be that they could get, that they would get harmed. I would want to see what's going on. But the big thing then, I'll just start to, I'll move forward with the patient and what they're doing helping. And if they tell me, yeah, it's working, then let's just, hey, let's give that a try. Let's give it a shot. Continue to move forward with that. If it fixes the problem, then that answers our question. On the same time, if you're like, I've talked to people and they're like, well, I've been doing this and blah, 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 and they're like way off base where I would be like, how long have you been doing that? And they're like, 8 months. How much better are you? Not. Well, maybe it's time to try something different, but at the same time, I can still be respectful and not, badmouth anybody, because I don't think that gets us anywhere. So that's it.
Yeah, I totally agree with you. You start bad-mouthing people and you have just sealed off a conversation that could have happened. Mm-hmm. You could grow together, the two practitioners, and learn from each other. But I've been in practice long enough that this happens with MDs, within just the MD community, I think it should be done that way, I think it should be that way, and really just being open-minded about, well, maybe there is something, more to what they're saying than I realize, or maybe what I'm saying more than what they realize, and just being open-minded to that conversation and really trying to keep the patient's care as the main objective. I have run into trouble sometimes with practitioners that are a little bit so protective of their patients, which we all get. We want our patients to do well, right, and feel good, and you want to help them with that. But they're not as willing to look at other options, and the only way that can change is over time, is having conversations and being available and talking about patients and having repeated conversations with those practitioners to help keep the door open for communication back and forth. So that's how I
Do you see a question up there you want to tackle?
What's TCM? Sorry.
Traditional Chinese
Okay,
medicine.
thank you.
That would be for Anne.
Okay. You do that one.
No. Oh, yeah.
Okay, so the question is, in terms of TCM theory, how do you apply it to sports medicine and also integrate it while collaborating with MDs, nutritionists, and chiropractors? In terms of TCM. So I think, as I was kind of talking about earlier, there's the Western anatomical viewpoint, where you're dealing a lot with muscles and muscular structure and understanding how a particular imbalance could happen. At the same time, keeping in mind the Chinese differential diagnosis, which I kind of look at more as the constitutional imbalance. So my approach is usually to start treating the muscle motor point imbalance. So for the acupuncturist in the room, like if somebody comes in with low back pain, what I would really start doing is looking at like the lower lumbar, the judgy points, and needling those. The glutes, the glute med and the glute max are really big stabilizers in the hips, so I'll always needle those. So I'll kind of use that as treating the pain component, and then I'll definitely treat the Chinese aspect of it. Is it a kidney deficiency? Is this person really overtraining? Do we need to tap into the adrenals or work at the kidney level from a Chinese medicine perspective? Is their digestion affecting their low back pain, which is always the case? I've been in kind of a working on a dye channel mode lately, and I've been seeing a lot of really great results with opening up the dye and just kind of getting the body balanced from head to toe. And of course, throwing in some complementary Chinese herbs. I do use herbs a lot in my practice. Yeah, I think, does that answer the question? Did you see anything, Dr. Pyron, up there?
What's your most common patient ailment complaint?
Can you repeat that into the microphone?
I mean, it looks like the couple questions are repeated, but the one in the middle that we haven't talked about is, what is your most common patient ailment complaint and or your main pain pattern of interest? So probably the most common patient ailment or complaint, talking musculoskeletal wise, is ankle sprains. I mean, I see ankle sprains every day, multiple times. It's just a common injury. And the second thing is back pain, low back pain. Those are probably the two biggest things that I see. And then knees and shoulders related to sports or whatever. I don't have a main pain pattern of interest, so I don't know how to answer that one. Again, mine is like pain is a symptom, but what's causing that? My interest is really what's the cause of this problem? Now that you're coming to me, and yes, I can. If you want pain medicine, I can do that, but that's not going to fix it. That just makes you feel better in the meantime. Let's fix it by figuring out what the real cause is. So that to me interests me in everything that walks in. What's causing this? How do we figure this out?
Do you have a favorite pain of interest?
Yeah. So a bunch of musculoskeletal stuff, it's tough to say like one thing. I treat a lot of runners. I see a lot of plantar fasciitis type issues. I don't know why I've become a magnet for those patients, but it works and I enjoy treating it. But really the things that I see, especially, of course, there's an old saying, if you're a nail, everything, if you have a hammer, everything's a nail kind of a deal. And so I do a lot of muscle work. I look for a lot of tight muscles. So really my big thing that I'm always looking for is that where's a tight muscle and then what's weak. And so there's always going to be something like that. There's an overcompensator and a weakness. And so that's probably my thing that I dive into. So know if that's a particular area, but wherever that's at in the body is where I'm going.
I think across the board, low back pain is something that I see quite a bit, followed very closely by shoulder pain. And I like treating shoulders. Shoulders are really cool. Once you get somebody's shoulder moving, it really changes their quality of life. And I think really, from what I've seen in shoulder injuries, frozen shoulder, that sort of thing, it's just muscles that are overcompensating for another set of muscles. There's 4 that basically are all there, and by working on them simultaneously using the motor point approach, you're able to innervate and bring better blood flow to those muscles. So if one is really overcompensating and one is really tired and weak, you're bringing them all back into balance over the course of time. And so that's one of the things I see a lot in my practice.
I have a personal question. You mentioned ankle sprains, and I sort of have chronic ankle issues because of the hypermobility probably, but I feel like I've heard recently that the icing stuff, maybe they're saying not to do that anymore. So I'm curious to hear, like, what is best practice now with icing sprains? Are we supposed to do that? Are we not supposed to do that? When will we use ice and when will we use heat?
That's all you.
I still use ice as initial treatment because you can have so much swelling and inflammation that it impedes the joint motion, which is, the sooner you can get it moving properly again, typically that helps with the pain and helps with the healing. So I still treat people initially to try and prevent too much swelling, and ice, I still suggest that to every injury, acute injury that comes in. Ice it helps with the pain, it helps, prevent some of that swelling. And heat on an initial injury feels so good in the moment, and then you may have a lot of inflammation after that, which then again may restrict the motion again, and that can be counterproductive. So I don't usually suggest heat. It depends. There's certain parts of the body that do respond well to heat initially, but heat is really good when it's tight. Now it's not so swollen, it's not inflamed. You didn't return to that really good range of motion with it, and heat will help with that. Helps circulation, helps with the healing. So I think I mentioned, I was talking earlier about anti-inflammatories and trying to get away from that, and that partly I think is the ice topic. Well, ice is an anti-inflammatory, but in an acute injury, for most people, they still benefit from that. It's the few people that don't need that then end up with this prolonged sort of problem. So I still use ice in the beginning, but only for the first couple of days, really.
I think the problem with that topic is because the guy that came out with that protocol, the doc that came out with it had done everything in the studies, and he came up with the RICE protocol, and then he just recently came out a couple months ago and says, that was a bad idea, we don't need to use it. And the problem is, of course, with the internet, that rapidly spread to all there, and so now we're throwing the baby out with the bathwater. No matter what, it still has beneficial qualities, because if you have so much inflammation, you start to have compression within the tissues, you're going to have other problems associated with it. So I think maybe when he said it, he's probably very intelligent, really smart researcher, whatever the case is, but we might have said that a little quick, and just to be able to throw everything out, because I've seen too many cases where it's done so much good for us to say no, not to, just to ditch that protocol altogether. Maybe it needs to be modified. And so maybe we need to have a discussion about modifying it, and we'll leave it up to the researchers up there for that. But from a clinical approach, it's still very good on the acute injury. So it's just kind of crazy. I'm hearing that topic a lot. And I'm like, ugh, it's like, wait a minute, because he just ditched out everything. And I personally, as a clinician, disagree with maybe the way it was brought forward, but it is what it is. So.
I would say I don't tend to see really acute injuries, so I think my philosophy might differ a little bit in that I tend to kind of like heat, but in the form of moxa. It's a modality that we could use anybody could really use it, but it's useful in acupuncture. With the idea that in a chronic injury, there's limited blood flow to that muscle, so using heat, it warms up that area and improves blood flow and nourishes that tissue to start kind of get the healing going again. I see it a lot in really chronic back pain clients who have had a long history and have used a long history of ice. By putting a little bit of moxa on it, it really makes a big difference in the heat. I think from a Chinese medicine point of view, that cold is trapped in the tissue, so the heat is actually driving it out and bringing a lot more mobility to the area. Great, thank you.
So there was one question that got away, but I think I got it jotted down here, and if I didn't get it right, whoever put it up there can chime in, but it was, how do you discern the combination of treatments that each patient needs based on the severity? So how do you discern whether that maybe they would need chiropractic or physical therapy or acupuncture?
I think after working with clients, especially in the sports world, you kind of tend to get like the back pain patients, the shoulder pain, the knee pain, the ankle, and you kind of have your ways of treating those clients. And I usually try to educate the clients that it's something that is going to take time to do. And if I notice that they're not progressing in the way that I would anticipate them to be progressing, or the changes aren't kind of in the average as to what I would expect, I'll start looking at them and figure out, okay, what do I think is a limiting factor here? Is it muscle tightness? Do they need to go to a more therapeutic massage modality? Do they need to have an adjustment? Do they need to go to an MD to get referred out for something a little bit more serious? So I think after a while, when you work with people, you kind of tend to get an idea or a foundation of how your treatment should progress. And then, you know, if somebody's not really making any significant change within 10 visits, I'm definitely like, okay, what am I doing with this client? What am I missing? And who do I need to bring onto the team?
So the question again was?
It was, how do you discern the combination of treatments that each patient needs?
Oh, based on that.
Yeah.
So, in my practice, I mean, an overwhelming majority of the people that are coming to me are generally, you know, typical stuff that I can fix. I mean, every once in a while I'll get somebody in here and I'm thinking in my head, you know, we're going through the history, is like, what are you doing here? You're in the right place. So I try to move them along, you know, outside. I just, you know, this is not probably the right fit. We need to get you somewhere else. As far as that, going beyond there, I'm real big on doing trials. I don't want to see people forever. I'm like, what we should be doing in my practice should be making a therapeutic change within 2 weeks, and we should affect your ADL in 2 weeks. If we're not seeing that improvement, then we're going to have a talk. We're going to go for diagnostics, or we're going to go for a referral, and that's just kind of my standard office policy. So unless I feel right off that I'm not going to be able to do anything. And a lot of times you want to know what their history is, because we don't know what they're doing, or maybe they've already been to a medical doctor, they already have some of that going on. So then we're at the point, because sometimes it's like kind of iffy, I'm like, I don't know if it's going to work, but if they've already been doing the other route that I would see in advance, then I'll say, hey, let's go ahead and we'll give it a trial. You know, but if not, I mean, it goes back, what's best for the patient. So that's kind of where I go through some point in my brain thinking during the history and exam.
The way I approach that is, I think most people would benefit from all three of our services. The problem is it's not always covered on insurance. So I've run into that problem in my practice when I had an acupuncturist, and John has worked with me as well, that, again, the patients may not recognize the benefits of those other services. They don't have experience with it. I can tell them, but they don't really know until they try. They may not even want to try just because they don't have that experience or positive feeling from it before. I'm just, again, hoping that, you know, as we kind of are types of practitioners that keep wanting to try to work together, that that insurance might change with that, and then so the standard medical practice of, you know, people that have insurance, it won't be this question of it's covered on your insurance or not. These are really great services that should be available, and working together benefits most patients that I see. But given that, I end up referring for acupuncture when it's a chronic pain type of scenario as soon as I can, just because I know it's so beneficial. So if someone who's come in and had that 8-year or 10-year or 20-year back pain or whatever it is, let's work on this together. And the person that comes in with an acute injury, yes, acupuncture I know can help with inflammation as well. But I don't always refer right then, because it's not always covered on insurance the patient's not interested in. And as far as chiropractic, John does some really good manual therapy, and some of that also can be done in physical therapy. So when I refer, since I have physical in my office, I don't usually refer for manual therapy to him, but I do refer when there's a joint adhesion, or it's not moving properly. It's not because there's a tendon issue, but we need to really mobilize, maybe get the spine moving so it's not you know, held up and then causing muscle symptoms. So that's when I start thinking about referrals for that. But yeah, I mean, I wish patients could have all three and more, you know, but I think it's going that direction at least, hopefully.
Hey, let me jump back to a question we talked about earlier when she was just talking. I think one of the advantages is, like she said, you see people that are still in two camps, like I'm only going to my MD, I'm only going to alternative medicine. And you'll have people, I mean, they'll come to me and they're like, they got every clinical symptom of pneumonia and they refuse to go to a medical doctor. I'm like, I try not to say you're stupid, but you know, we try and coach them in another way, like you're going to have to go see somebody else about this. But the neat thing, going back to the whole integration that we have, is that if they really believe and trust in me, and I go, look, this is not an option, go. You know, and they'll do that, and so then they'll hop over, and then they'll go to a medical doctor, they'll do that same thing. And I have the same thing, I've had patients come to me before, like, I'm pretty scared of chiropractors, y'all kill people, you know, they'll ask questions like that. Have you ever broke anybody's neck? I'm like, not this week. Anyways, but you know, you'll have people ask that, and they're like, and I would never go, but Dr. Pyron said you were good. So, you know, because of that, then we're bridging that between, we're bridging the population of the patient base because of our trust of each other. They feel that. And so because of that, we're able to open those camps and do stuff like that. And so, again, that's pushing for all that. So that's awesome, too.
I think, in my mind, this is sort of related. The question that is, so how does a practitioner find other practitioners that are interested in integrative sports medicine in their area? Are there, I guess I'm guessing this question is wondering, are there like forums or networking groups or things like that? Is that sort of?
Somewhat.
Yeah. Do you want to elaborate?
If you're a starting acupuncturist and you want to do sports medicine but want to integrate with a doctor of chiropractic and an MD, how do you find them?
So the question is, if you're like a starting acupuncturist or a starting practitioner and you want to integrate in the sports medicine area, how do you find those people?
Here we go. Oh, you go ahead.
Two ways I would suggest, or that has worked for me, is when you start working with clients, and you should have a line on your intake form that says who's your doctor, and I guess get their approval that you could contact them and send them a letter, a report of findings. I'm working with your client, blah, 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 they came in for low back pain, this is my assessment, and you probably won't hear from the doctor, but if you continually send it out, after a while they're going to be like, who is this acupuncturist who keeps sending me stuff? And you're going to create a relationship and a dialogue. The way that I've really met people is by doing events like this, like going and volunteering your time at the marathon, going and volunteering your time at any of the sports, any of the running shops, the bicycle sports shops, the Melajani's. They're always having events, and they're always looking for people to work it. And quite honestly, while you're waiting for the people to show up, you chit-chat behind the scenes with the people who are there, and that's really where I've met a lot of the people that I've been able to kind of build my professional relationships with.
Yeah, so she hit it right on the head there. I think that you need to decipher your base, what that's going to be, and you know, if it's one you want to treat cyclists, you know, showing up at cycling events is going to be a great thing. And then start asking around the community. I would find out, and if everybody says, you know, Dr. Jones is the guy that treats all the cyclists, you know, he's the sports guy or whatever. Then I would reach out. I would call. I've tried that before, and I never really had an effective thing. I just get on the phone. I would call them up and say, look. But the one thing I would encourage everybody, if you're going to call anybody on the phone, it's not like, hey, I need you to send me patients, because you do that, they're just going to hang up on you. But it's really more like, what can I do for you, or how can we benefit the patient together? And if you'll reach out and you'll make an honest effort, I think that you're going to get some doors slammed in your face. That's fine. That means you're good there, and you move to the next one. And then you're going to find somebody that's like, wait, I've been looking for an acupuncturist. Well, there you go. So you got to start there, and then you send them some patients, and then hopefully you'll see some fruit from that come back the other way, and just do a good job. Try to communicate with them. I always try to ask, like, what do you want? Do you want notes back? Do you want me to call back? Do you want me to do backflips? What are you looking for? Whatever the case is. And so, because everybody has different expectations, because if I never hear and I sent to Dr. Jones and then he referred them to somebody else, and then it's like, what happened to my patient? I was, all that kind of stuff. So good communication, and just do it. You'll find it. You need to forward lean, and you need to figure out what you can do to help them out, and be in the arena that you want to treat. If you will get in there and you'll start asking, it's a simple thing, but it takes time. So the relationships that that I built did not come overnight. They take time, and you got to build up trust, and especially when you're hopping the boundary from east to west. When you're going there, I mean, you got to find somebody, and it takes faith on both sides that they're not gonna go there. Because I referred to a guy one time, and he said we shouldn't go back to chiropractor anymore. I was like, nice. I'm like, thank you. You know what I'm saying? I mean, it's like I was treating this guy for back pain, and we were getting relief, but I really thought this guy could benefit, and he turns around and slaps me in the face, and I was like, wow, so how many more referrals did that guy get from me? You know what I'm saying? But on the flip side, we have whatever the case, and we've had one recent, like 6 months ago, we had one that I was treating, and then we found out there was a fracture, and we're done adjusting, we're over, and at that point, Dr. Pyron assumed care of that, which was great. It was what the patient needed, we did that. And so, but we had communication. She let me know what was going on. This patient just didn't disappear off the radar. So I think when you do that, you lean forward with that, you're gonna, and expect it to take time. Do good work.
Yeah, I agree. Do good work always. You make your name by what you do, right? But this is really a marketing question, right? How do you connect with the right person, and how do you build relationships? And from my perspective, yeah, you can send a letter, and I'm like, yeah, they're just marketing to me, until I have a face-to-face with that person. And that's true for any other physician, or other practitioner. I need to know, I need to meet them. I need to have a face-to-face, get comfortable, understand their philosophy, how they treat. I have an ankle surgeon I send people. I don't do the surgery part, but I have a shoulder guy that I send to when they need surgery, and it's big over time, developing those relationships and really trusting that they will do a good job for your patient and not, ditch you in the meantime. And so my advice is to keep working until you get the face-to-face with whoever it is. And if you're looking for sports medicine, there's a finite number of sports medicine clinics in Austin. You just keep calling, stopping by, sending them a letter, send them cookies, whatever, until finally like, God, okay, come over, I'll meet you for coffee, dang it, But to get that face-to-face, and they suggest it does take time. It takes about at least 6, efforts with that one person to maybe get the phone call that you then can set up the time and meet face-to-face. So you have to keep the persistence with it, and have a target that you're looking for, because you can't do that to every physician in town, but if you're looking for sports medicine, just make that list and just keep hitting them with, I'm interested in working together. I'd like to meet and talk about our philosophy of treatment and see if we can refer patients back and forth. So that's what I'd suggest.
One other thing I can add with that, what's been unique in my practice that I've seen a recent trend over the last 18 months, I started getting a lot of referrals from other chiropractors, which is just unheard of. We don't refer to each other because we try to treat everything. But I've developed a niche there, and what I do is that again, even just as sensitive as I would be to a medical doctor, I've treated that patient and sent them right back. I've taken what I do that I've worked really hard on, and I've treated patients, and so I've got this one guy that's sending me a patient like every other month, and I'm telling you, from the chiropractic approach, I don't know how it is in the acupuncture field, but that just never happens. So it's really cool, but it's just again, that's kind of leaned back on my reputation and what I've done, and then I've taken extra care to make sure they get placed right back where they need to be once we get done with the injury or the issue that I've had to deal with.
Yeah, and I would add one more thing for the acupuncturists in the group. I guess it goes without saying, but when you're dealing with the Western medical community, you don't want to talk in terms of Chinese medicine. You need to figure out a way, in your words and how you're comfortable, to talk about what you're doing during treatment. I never talk about getting qi during a treatment. I talk about the needle is inserting into the skin, we're tapping into the body's naturally healing properties by improving circulation to that area. We're moving blood flow, we're bringing red blood cells, white blood cells, lymph to that area to create healing. And you kind of have to have your brain and your practice operate in two different worlds. You're practicing Chinese medicine, but you have to be able to communicate and translate that into a Western model. And I think that's really how you gain respect by the Western practitioners, when you can walk in and speak their language and understand what they're saying, and then transfer that in your mind into a Chinese medical model is I think, something to kind of keep in mind.
I know we have at least one question from the audience. What would you like to ask?
That's a quick question for Ann. Has your use of herbs changed or evolved in the years since you started?
Has my use of herbs changed or evolved since I've started? Honestly, because of the limitations in my practice space, I rented a room out of one place. I didn't have access to a full pharmacy. I mean, there's Aoma pharmacy here that I'll send scripts to for powders and that sort of thing. But I've tended to find that I've gravitated a little bit more towards patents and using them kind of more, I'm tending to use more patents right now. I think it's just a little bit easier for me to stock, especially when somebody's in a more acute situation. It's really hard to say, okay, you're in pain, now drive down to Aoma and get your herbs. Hopefully that'll change. I do miss doing kind of more of like the individualized formulas, but it was really just limiting for practice size that kind of pushed me towards patents.
Are there any other questions from the audience? I know maybe not everybody is into texting, or I'd love to also make this a little bit more of a two-way conversation, so if there's anything else out there that you guys are wondering. Maybe you do like the texting. Okay, well let me see what else is on my list here. We've talked about lots of these. Let's see. This one's been up there for a little while. If you were to add an additional technique, modality, body of knowledge to your current skill set to help your patients, what would it be? That sounds like a fun question. Does anybody have anything that you're looking at adding to your skill set or you wish you could do?
Just me or you? I'll go.
I got some too.
I'd add Dr. Parent to my office.
I really like what I do, and I really like that I know where my limits are with that. And so there's nothing actually that I feel the need to add right now, or that I feel like I want to add, just because I really enjoy my days, and I enjoy my interaction with my patients, and I enjoy helping them figure out what's wrong and helping direct them where I think they may get optimal care. So there's not like a oh, I want to do that. I'm kind of doing the things I really like to do, and I feel like the approach is, my approach being not just thinking of what I can do, but how we can integrate together, is fun. So I'm good.
So I really am constantly looking for anything, but like she said, I got to stay within what I do. I'm always looking for any kind of continuing ed. I love taking continuing ed, and I take it like crazy. I spend a ridiculous amount of money every year on continuing education, but it has to be straight in line with what I'm doing. I'm not going to take a nutritional seminar. I don't have interest. It's not that I think that's great, but that's not what my forte is, or what I'm really, really good at. So it has to be something in line, and I'm always digging around. I take usually 4 or 5 times the amount of hours a year for CEs than what I would have to take by law, just because that's what I want to do. And I strive every single day. I want to take continuing ed that's going to make me the best practitioner that I can be for the patient. And I think there's a lot of other chiros out there that are doing as good or better job than me, but I'm going to be the best that I can possibly be. So I'm always looking to that. I'm really interested in cold laser right now, but so that's a kind of thing. And I signed up for a seminar yesterday. I'm gonna take the seminar prior to purchasing it, because it's a pretty big chunk to purchase one. So.
Can you tell us what that is?
Cold lasers, everything is laser now, so they're doing a lot of surgery stuff with it, and they're finding on the other end that they can actually impact the tissue. They can impact the tissue using cold. We can penetrate to a certain amount of depth, and they can increase the healing function, which is kind of a balance of a lot of acupuncture and just chiropractic is different from ultrasound, but you're actually making an impact, and some of the results on it are really amazing. Some of the stuff we've seen on it, but a machine is 15 or 20 grand, so I'm not going to throw that out until I've actually seen, experienced, and understand everything, how it's going to benefit. And it's one of those things too, insurance doesn't pay, so then it's going to be something that I'm going to have to put a big chunk of change in and then turn around and have to resell. So it's going to be one of those, there's a little hurdle there, but in the sports field, it's doing lots and lots of good. So I'll find out, I'll let you know after my seminar.
I'm right there with Dr. Tuggle. I am like a CEU junkie as well. As a matter of fact, I'm like, okay, no, just slow down a little bit. I think right now my interests are, I alluded to it earlier, I've been kind of fascinated and taken some classes in what's called NKT, it's neurokinetic therapies. It's kind of going back to like the muscle connection to the brain, and kind of the idea along the line that there's a muscle that's out of balance, but it's not necessarily out of balance because of its strength or weakness, but how the fuel or the messaging that's getting from the brain. And I'm in the middle of a year-long training program in color puncture, which is using light therapy, different color light therapies on acupuncture, and it's been really great in pain patterns. It goes deep to the cellular levels, so you're really able to, Chinese medicine, you can kind of go superficially and go either into the fascia or into the meridians, but the color puncture, combined with that, you're able to kind of go a little bit deeper and affect cellular change, which is really kind of affecting deeper change in the person's body at the level of that pain pattern. So I think that's kind of where I am now.
Sounds like a lot of cutting edge techniques going on there. Let me see. How do you address pain at the end range when the patient has normal range of motion? I was like, range of motion. Anyone? How do you address pain at the end range when a patient has normal range of motion?
I'm not sure, I don't understand the question.
Yeah, maybe clarify that. just a little
Clarify?
bit.
Is it pain at the end of range of motion?
Yes.
Or pain at the end of pain cycle?
End of range of
At the
motion.
end of the range.
Pain at the end of range of motion, okay. So how do you
Like the
address
range of
pain at
motion.
the end of motion when a patient has normal range of motion? Yeah, so that's not it's not a range of motion issue then. It may be the capsule, the joint capsule itself may be the problem. So it's not a tendon or, So it's trying to manage that pain so that they can still be mobile with that joint. If you don't, then you can end up having frozen shoulder issues or whatever. So again, what's the cause of that? Is there an inflammatory response? Is there an arthritis issue? Is there something lupusy or whatever else going on that's causing the joint? It's got motion, but it's inflamed or whatever. What's the cause and how do you fix that? So, and then you can take a pain thing for it, but really what's causing that and then figure that out and then have a plan from there. Sorry, that was generic. Sorry.
Yeah, it's not probably the same. I don't really
Yeah.
think that.
Yeah.
Just because the range of motion is normal, obviously it's not normal if there's pain. So there's something else going on besides that.
I'm going to jump back to this other question that got brought up. It is kind of a continuation of the icing question. What about the chronic over-icer?
Again, my favorite word is balance. Not too much of anything. So if someone is like just hanging their hat on that one thing, that's all they ever do, then they may be missing out on some other things that could be helpful. But we actually offer, I'm the medical director for Ironman when it's here, and for Livestrong, and for Captex Tri, and all those big events, and I coordinate the medical care for those big events, and I'm usually in the medical tent at the finish, treating people, and we provide ice baths. Not so much for tendon stuff, although people jump in for that reason, muscle or tendon issues. Mostly it's freaking hot here, and those events are held in a hot period of time. And so medically, you get overheated, you can have, fainting issues and all kinds of other issues just because of the temperature. It's a fast way to cool them down. My experience, I keep a lifeguard, for I usually have a bath for people who just want to come in and out, ice bath, and I don't even look at those people because they're walking and talking, everything's fine. And I'm not advocating that they do that, but there's so many people that want to do that, and they just feel like it affects their recovery. So I'm not going to argue with them. They can do that, that's fine. But the reason I have it there is overheating and more medical issues, and then I'm with them and maybe getting an IV going or whatever else needs to happen. So.
I don't know. I used to ice bath a couple weeks ago. We had a race here.
Yeah.
And it was I came across the finish line and it was so flipping hot. I was like, and it's the same thing. It was like, it had nothing to do with inflammation per se, that I was trying to cool down because I was rather peaked at that point. I think that you have an education issue. You have athletes, some are really coachable and some are not. And so sometimes you find people, they're just straight up knotheads. They've got this thing, they read this out of a book and they're doing that and they're not taking any other way. And so, at some point I'll try to, offer some advice or maybe offer an alternative, and if they're receptive, maybe we can continue forward. If sometimes people just have to accept that in their head before they'll take that. You can't really do anything about it. But one of my favorite sayings, I love saying at the office, is, they'll come in and they'll say, well, I've been doing this and it keeps hurting, and I keep doing this and it keeps hurting. And you'll hear that over and over, and I go, well, I have this one, it's called the definition of insanity is doing the same thing over and over and expecting different results. I'm like, if you want something different to occur, you gotta do something different. And so generally, man, I mean, I can get a lot of lights to come on when you do that. So, you know, when you can break through and they'll become, they hear what you have to say, and it's like, look, do you wanna get better? You know, you're gonna have to change something up. And so then at that point, then you can have the conversation with them. So that's what seems to work.
Yeah, but if it works for them, I mean, you know.
Yeah, I mean,
Works
if it's,
for 'em.
yeah, it's not a pain though.
Yeah.
It's not a problem.
Right.
I agree. I think patient education is probably the key. Sometimes clients don't know that there's an alternative to an ice bath, so giving them some options or maybe explaining, I guess from a Chinese medicine point of view, how that might not be benefiting them very well. And I've also learned over the course of time is you have to find a way to meet the client where they are by gently guiding them along. By saying, no, you cannot do that, this is really bad, you're basically going to lose, they're going to lose trust in you, and they're going to shut down, and they're not really going to listen to anything that you have to say in the future. So, yeah, I tend to just kind of educate, explain why from a Chinese medicine point of view. Most of the time they're like, you know what, that makes perfect sense. Mm-hmm. One of the things I always say is, how do you feel when you're coming out of a shower, after a nice warm shower? Do you feel better? Is it pain better, or is it aggravated? And that prompts them to start thinking about other ways of potentially treating their pain.
So I do want to let you all know we're probably going to wrap up in the next 10 minutes or so we won't keep you here till 9 o'clock. So if you do have any burning desired questions, you might want to raise your hand and get my attention or throw them up there. Yeah, Brenda.
Yeah, this is to Martha, and you said you coordinate certain sports events, athletes events. Do you have acupuncturists there on the?
I don't coordinate the event, but I do coordinate the medical care. So I work with the event coordinators, and I don't usually have an acupuncturist. So I'm totally open to that, sorry. I don't, I'm coordinating, what usually happens at these big events is there's a medical tent for the people that might die, basically. You know, they may have a heart attack. I'm serious. You know, they've had heat stroke, and that's what I'm there for. And my staff is there for that, and we're trying to weed out the people that really have a serious issue that we need to put in an ice bath because their temperature is too high and they're going to maybe have a seizure or something, right? So that's what we're there for. And then in the festival area, there's usually massage tents, and that's, you know, they're walking and talking and everything's fine. They don't come into the medical tent. And I certainly could see the benefit of having that, but in my area, it might be in my way of, there's an emergency, I got to deal with just this thing. And I don't coordinate the massage people, and I wouldn't, you know, the event director would do that in the festival area of it. So it would be nice if we had a bigger tent and more room to do all that. That would be great, and I think it would be a great service to have. But that's not actually what I do when I'm at those events. Mine is really more acute care of, this is an emergency, we got to make sure they either need to go to the hospital now, or we can manage it here, but I got to have my eyes on them the whole time. Or, okay, you're tight, you got a muscle thing going on, we'll talk about it, but that's not the main job for me that day. My main job for that day is to make sure nobody dies, and that they all can walk out, you know, or helped out if they need that. So that type of care I think would be very useful, but I'm not sure it'd be in that setting that would be the best place for it. But yeah, I would love to talk to the event directors if anybody's interested in doing that, because they have different people that come for massage and treatments, physical therapists and stuff that are out in the festival area, and I could see where that would be a nice addition to that.
Logistically, that's going to be a challenge. Though.
Correct, yeah.
I think logistically it's going to be a problem. With the athletes, you know, coming out, they're like smoked, they're dripping wet, you know, and then they're like, they want it, but you got to be right now. They want to stand in line. You got to do it and shine in and out. I think it would be challenging. It would be great to add more therapies available, but you know, again, these are short term. We got to be in, we got to be out at a certain time. And then the problem you're talking about is some of these events are several thousand people. So you know, it's like how many people could you work on, or how many would it take? So logistically, I think it would be really, really tough. Yeah.
I actually did try to do that. I did try to do support at a Austin Flyers event. They did their 100-mile ride. It's a century ride, what they call it. It was really hot, and I did acupuncture, and one of the girls fainted. Because they're just so hot. Like, the body is just gone through this tremendous stress, and then you throw acupuncture on top of it, and the body's like, whoa, I can't deal with this. So I stopped doing it at events. one, logistics and needles, and people have to sit, and you have to kind of greet people and talk about your service and make sure that they're doing okay. And so now what my focus is on recovery, finding a way in your practice, in the way you treat, that you could help those people recover. Could it be an herbal formula? Could it be Shingmai-san that you just make in little packets and you give them out with your business card, and you're there talking about you and acupuncture and how it could help. You could have it already made and you just give out little drinks, and then they could get a feel for how that is. You could, like I think the herbal route is something, because it's something fun and people are like, oh, what's this? And they're willing to taste it, and then that way you're actually helping more people at more time than trying to do needles in a time when the body's already pretty stressed out to the max from the effort that they just did. So.
Anything else you guys are pondering? Yes.
I'm interested as an MD, what interactions do you see with herbs, if at all? Like, and what are your concerns? Like, do you have any concerns from a biomedical standpoint? And what have you been, if any, like outside courses that you take that may have brought that up as a concern?
I have a book. My experience with that is people don't tell me. They won't tell me for the first 3 times I see them that they're taking an herbal thing. And I'll have no, and we've talked about their medicines, we talked about their allergies, we talked about their illness, we talked about things, and they're not, and I ask specifically, are you taking any supplements or herbs, or, you know, they don't tell me about it. They don't think about it when they're talking to a medical doctor. And so that's the most common thing I come across, is they don't tell me even though I ask them. And then I'll find out later, and most of the time there's not a conflict, but sometimes I've seen conflicts with antidepressant type stuff, and anti-inflammatory type stuff. Sometimes heart rate, when there's a cardiac issue possibly going on, that they have an elevated heart rate and it may be related to an herb that they're taking. Most of the time I don't see any conflict. Most of the time things are working fine and it's helping them, and that's great. I am not an expert at all. I mean, I literally have a book. I'm like, oh, you're taking that? What does that do? You know, and I look to see how that might interact with other things, but the biggest thing is back to patients don't think about telling me that because I'm an MD, you know, and they tell that to other people, and they don't tell them necessarily the other things sometimes, you know. So that's the biggest thing I come across, is really just not having that information.
Any other questions from the audience? I think if you guys don't have any other burning questions, I wanted to just see if you guys had any, like, closing statement, or anything to just wrap it up. I personally, I love the sort of theme that's sort of come up around the team playing in the integrative sports medicine arena. So I'm really glad to hear that. Maybe that's not happening everywhere, but it seems like some places it is. So that's really wonderful to hear. Does anybody have any last closing statement?
She's gonna sing.
In the theme of integration, I have students that come shadow in the office all the time. So if there's students that are interested in doing that, and just see kind of what I do as an MD and how that might integrate with what you guys are trying to do, you know, and what you're doing, I'm open to that. So if there's anyone interested in that, to me that just fosters this integration that we're all trying to do. So that's my only closing statement. Come see me if you want.
Yeah, I think that, and just you know, because there's a lot of clinicians out here, just to be passionate, be true to what you're going to do, and I think if you know everything that I had, I was telling somebody, we were talking before the class started, because I feel today it's like I'm so excited every day to go to work. I have my dream practice, and it's something when I was in school, I was like, man, I can't wait till it gets like that. And the first couple of years were very sober and in a bad way, and so it was really good that I finally got to the place where I'm at, and I took the path, and I took a straight line, and and I just stayed to it, of course there were some bends in it, but, I stuck to it. But I think if you do a good job and you really focus on putting the patient first and putting their best interest in, whether that's integration, and helping out with other providers doing whatever, it'll come around. And I just want to tell everybody, because I went through a real time, I was like, I made a really bad choice, and I really did. I was like, for a few years, I was like, this is horrible, I should have sold used cars. But now when I look back on it, I'm like, man, I'm exactly where I'm supposed to be, and I'm so excited about it. So, stay strong, stay true, and just keep at it.
Yeah, I would agree. When you first start your practice, you're going to be seeing all sorts of different patients, and then you're going to find those that you start thinking a little bit more about, or you're going to start researching a little about, and pay attention to those little cues, because I think that'll show you where your interests lie. Yeah, and I think just patient care, like putting the patient first. I mean, sometimes as acupuncturists, we get a little bit caught up in our own egos and defending the medicine and defending, Chinese medicine, all that kind of stuff. And really it comes down to the relationship between you and the person in the room with you, and giving them your undivided attention and your care. And it's amazing what just listening to somebody will do. It's transformative really for people. And then also too, I know that I've talked a little bit about some different ways of treating pain from an acupuncture point of view, and I have some cards back there if anybody, feel free to give me a call or talk. I know I'm only one of 3 acupuncturists in Texas who's kind of certified in the sports medicine acupuncture program, which is a different approach, and I'd love to help if anyone's interested. So thanks.
Well, thank you all very much for spending your evening with us, and thank you as well. I also wanted to mention, because I forgot to mention at the beginning, while these events are free, we do accept donations to our Herbal Outreach program. Herbal Outreach is a program that we have here at Aoma through our student clinics, where we provide free or low-cost herbs and acupuncture treatments to people who can't afford them. So there is a little tip jar, a donation jar on the back table there. Also, please feel free to help yourselves to any of the literature. And last thing is I'm going to be sending out a survey, so please let us know how we did and what you would like to see in future East-West Forum events. So thank you again. Let's give these guys a round of applause. Have a good night.